Hello and welcome to the RCM Chat Podcast brought to you by AGS Health. I'm your host, Michelle Dawn Mooney. And today we're talking about E&M 2023 code changes and impacts. We will take a closer look there and have some great information for you today from two great guests that I'm happy to bring on. Leigh Poland is the Vice President of Coding Service Line for AGS Health, and Lingaraja Prabhu is the Executive Director for Coding at AGS Health. Thank you both for being with me today.
Thank you so much. It's such a pleasure to be here and talk about one of the industry trends right now concerning the new 2023 E&M guidelines. So thank you so much.
Thank you, Michelle.
Great to have you both here. So let's get started. But before we do, I think it's always nice to hear a little bit about our guests. So starting with you, Leigh, can you give us a brief bio before we kind of get into the Q&A?
Absolutely. My name is Leigh Poland. I'm VP of Coding Services at AGS Health. I've had the pleasure of working at AGS now for about 10 years and have been in the revenue cycle management space for about the last 25 years. My previous employment was involved with healthcare organizations like Pearline, ISIS, Steward Healthcare. And I have my RHIA, my CCS, my CDIP, and as well as an AHIMA approved ICD-10 trainer. But thank you so much for having us today, Michelle.
My pleasure. What about you, Linga?
First of all, thanks for hosting me here today. I'm Linga, Executive Director, Medical Coding at AGS Health. I have close to 20 years of experience, out of which my first couple of years have been with physiotherapy. As I completed bachelor's in physiotherapy and did clinical practice in physiotherapy for a couple of years before I got into revenue cycle management. And with RCM, I started off as a medical coder, got opportunity to work on multiple specialties in professional coding. I'm a certified professional coder from AAPC and certified project management professional from PMI. Out of those 18 years, my first 10 years was with E4E Nittany, and then last 8 years have been with AGS Health. At AGS Health, I manage operations for professional coding, and it's been close to 8 years. I've enjoyed my journey with AGS Health. I've worked with Leigh on several initiatives when it comes to coding services and training. Excited to be part of this session and looking forward for it. Thank you for having us here, Michelle.
Yeah, once again, my pleasure. And I'm excited to get into the conversation because you mentioned you and Leigh working together. And I think, both of you are going to have a great conversation about this. And I'm happy to kind of be a part of it and lead things along. So let's start off with this. We're talking about changes because change is inevitable. So let's get into it. What changed in 2023 on E&M guidelines? And then how is this different from the old guidelines?
Well, so this is a significant change in 2023 guideline. We have almost come across 5 months down the line since got implemented in 2023. But if you look back the history track, the last guideline that was implemented for E&M was in 1995 and 1997. It's almost 25 years since a major change was done to E&M. There have been small updates year on year, but this is a significant change. And if you ask me, in my opinion, this change is very important. There has been a lot of things that was not needed, which has been removed. Most importantly, elimination of history and physical from calculating the A&M levels is the biggest change, and some additions to the way time needs to be calculated, where the major changes, comparing it to the old guideline. Now, 95 and 97 guideline is gone, and we have 2023 guideline, the biggest change. The biggest impact is it reduces a lot of time and efforts for the physicians, as well as for the coders and for the administrative workers like scribes as well. So this is significant change. Everybody was looking forward for this for so many years. Now we have it. We have embraced it, and we are almost down the line in the learning curve. Leigh, you want to add anything to this?
Absolutely. And as Linga noted, some of the key changes were definitely regarding the history and physical, as well as the time calculation. And also, as Linga noted, major changes, as you can imagine, not touching the E&M guidelines and making significant changes for almost 20 years, and then completely revamping those particular guidelines has definitely been a learning curve for physicians, for coders, for staffing as well. A couple other things I would just note regarding the guideline changes is observation. The observation codes were actually merged with the inpatient codes, so they do not have their separate section any longer within the E&M code set. And so now we see a code set that mentions inpatient and observation coding. And then one of the things, I've been in AAPC HealthCon this particular week. And then also in talking with our clients, one of the areas where coders really struggle is with that MDM table and some of the definitions and terms within that MDM table. So, for example, you'll see a term like acute uncomplicated illness or injury. And so AMA has clearly defined those terms in the new guidelines of what is an acute uncomplicated illness, what's a stable acute illness. And those are just a few examples. And there's an exhaustive list within the E&M guidelines. One of the things I will say in listening to several of the webinars is they would like for AMA to kind of give us further examples of what is a stable acute illness. Even though they define it, they really would like to see some of those, additional terms or additional illnesses that kind of fall within that particular category. But very interesting to read through the changes. And Linga and I could actually probably talk a couple of hours regarding the E&M guidelines, but as a high level, those are some of the things that really stood out to us regarding the updates.
So with the update, Linga, you had mentioned the new updates, the basically not being necessary now to have history and physical examination documented. So let me ask you this, because with the new, I'm curious about the old. Do the 2023 guidelines mean that the 1995 and 1997 guidelines are completely obsolete?
Well, that's a good question. Answer is yes and no. At this point in time, where we are standing 5 months down the line since it got implemented, for any date of service after 2023, this guideline is only 2023 guideline is only applicable. Whereas if we have to work on some denial management or any post submission audits, which are date of services prior to 2023 for inpatient and which are date of services prior to 2021 for outpatient, then there is a need for using 95 and 97 guidelines, because that's what we were following at that point in time. So the need for having 95 and 97 is still there for a brief period of time until all the denial management requirements and the post submission auditing requirements are gone. Then after, maybe it might take another 6 to 8 months for that, but after that it is all 2023 guideline. Then you can make it absolute. There'll not be any need for 95 and 97 guidelines at all.
So how do the new 2023 E&M guidelines impact physicians, the coders, and then more specifically, our whole goal is to worry about the patient. How does it affect all of them, including the patients?
So this guideline change was itself brought in to have significant impact on the way physicians are documenting. So it removes a lot of anxiety and the documentation pressure that physicians have. So definitely, because historically they had to document comprehensive history, comprehensive physical examination, even when the level of care is only about to level 3 or level 4. Now there is no need for it. The new guideline says that history and physical exam needs to be documented only to the level it is medically necessary or medically appropriate for that particular visit. So this definitely removes a lot of administrative work away from the physician, so that they can focus on the medical decision making, which is critical, which is not the only critical, but which history and physical are important, but the most critical part of any outcome of treatment is relies on the medical decision making. The physicians can focus more on complexity of the problem addressed, on the risk factors towards the better outcome of the physician. So that way, this is definitely a great relief for physicians, and similarly for coders. They don't have to review pages of history and physical examination before landing up to MDM. So now that E&M levels can be calculated directly from the MDM, it removes a lot of time and effort put on reviewing history and physical, and focus can be only on the MDM. And end of the day, this is going to have significant impact on the physician's outcome and treatment. So it's win-win. Removes a lot of time and effort for all the stakeholders who are involved in E&M care.
And I'll just add to that, the AAPC, I was looking on that website in preparing, and the term they used regarding the E&M updates is major overhaul. And as you can imagine, with coders who have been in the industry 5, 10, 15, 20 years, they're used to those 95, 97 guidelines. And that's a lot of changes for this particular year. And so, again, it's that learning curve for coders. They need that continuous education, continuous support, really need audit feedback on how to apply those E&M guidelines correctly is critical. And we have seen, just as we saw with the change from ICD-9 codes to ICD-10, that dip in productivity. And we do anticipate seeing that for 2 or 3 months more as coders really get used to those new E&M guidelines, and again, how to apply those the new codes and the new guidelines with their particular accounts. So just continuously working with them with education and with the audit support is critical.
What would you say healthcare organizations can do to ensure that they're not missing out on any reimbursements from E&M coding? How can they leverage computer-assisted coding technology?
So there were two parts to that question. I'll take the first one first. So what healthcare organization do to embrace this? Basically, that was the question. So when this started in 2020, I think 2023 was when it was E&M change was implemented across all the place of services where E&M care is done. So the initial training was given when somewhere around November and December, so that when we started coding for January date of service, this was implemented. That is done. Most of health organizations have completed that part of this learning curve first. But what is more important is to have continuous learning, because coders have been following this for several years. Leigh was pointing that out. 95, 97 guidelines for several years, and this is a big change. So continuous learning is important based on the feedback, right? That's the first part I would say. The second important thing that we have to do is auditing and feedback, because it is not when feedback is not only for the coders to embrace this learning curve, but also for the physicians. We had a situation where we were talking to one of our physicians, and we were trying to give feedback around the need for having only medically necessary history and physical, where some of the providers were still documenting comprehensive history and physical. So the physician was shocked to see that, and assured us that he'll go back to the doctors and tell them that there is no need for documenting comprehensive history and physical when it is not needed. It can save a lot of time, because it's a learning curve for both the physicians as well as for the coders. So auditing and feedback for next 3 to 4 months at least is more important. And as healthcare organization, we have to take that responsibility. As the medical coders, we have to take the responsibility to share the trends as to how their work views are trending, how their total and work views are trending, and compared to what it was in 2022 versus 2023. Because physicians are also concerned how we have been talking about the changes in coding, but they are very concerned about how does it impact. Does it really take away the revenue, take away the our views? But it is not. What we have seen is there is a slight increase in level 4s and level 5s. So it is very important to track these acuity trends, compare that with 2022, share that with providers, and tell them that this is where we are. So in case if there is a dip or if there is a spike, then it is important for the coders to share those feedbacks on regular basis, so that this can be handled effectively. So that's the response I have for the first question. And I think the second question you touched upon, CAC, that's a great question, because when we look back at our customers, most of them have embraced CAC on facility coding, whereas for professional coding, there is very less amount of embracement when it comes to CAC. We are not very sure why that happens, but looking at the simplification of guideline on ENM, I think this is the golden period. Healthcare organization can go ahead and adapt CAC, because the guidelines have been simplified. The things are made easier, and it becomes easy for the system to learn. Machine learning is easier now, and because ENM is always considered as it's not black and white. There's a lot of subjectivity involved when it comes to MDM now, which is kind of streamlined and simplified now. And I think uh, if you have to ask me what is the right time, this is the golden period which we can I would recommend all healthcare organization go ahead and adapt CAC for professional coding, especially on ENM.
Right. And I'll echo what Linga was mentioning about CAC. We have a lot of exposure to clients across the US, and we see them investing in tools for facility coding. But where we do not see many of our our clients investing for tools for coding is on the professional side. And as Linga was mentioning, this is a perfect time for them to make that investment, not only for the E&M portion, but also another buzzword in the industry right now is risk adjustment coding, making sure you're getting, capturing all of your diagnosis codes correctly. So it's a wonderful tool in order to support your coders in coding accuracy, as well as coding productivity as well. So cannot say enough about embracing that tool. One of the other things that I would echo to the first part of that question, and just, what are healthcare organizations doing to ensure they're not missing reimbursement? I would say look at those documentation trends. Where do they see opportunities for improvement in regards to not only the diagnosis piece and making sure that you're coding, documenting to the high specificity where we can pick up diagnosis codes to the high specificity, but also we have noted trends where if the physician would document things just a little bit differently, like for example, making sure when there's a test performed, documenting the interpretation in their documentation, that would help assist them in obtaining a higher level E&M. So look for those documentation gaps and see where you need to provide education, not only to your coders, but also your physicians as well, to ensure they're not leaving any of those reimbursement opportunities on the table. And that's one thing. Linga and his team are excellent with working with our clients to help, share with them some of the documentation trends we're seeing on our end as we're kind of walking through their charts and the code assignment.
Yeah, great points. And, the bottom line is, the bottom line, of course, we all want the best outcome for the patients at the end of the day. That's the ultimate goal by anybody in this field, but it does come down to revenue. So we've covered a lot here in this conversation. Any final thoughts as we're wrapping up?
Absolutely. Coding is always changing. I've been in the industry now for 24 years, and there's never a dull moment. It seems like we have code updates quarterly, yearly, twice a year. I mean, it's always evolving. And E&M and AMA did not disappoint this year. As I noted earlier, the term AAPC used is overhaul. They did overhaul those E&M guidelines. And what we feel like as a team is we're really hoping AMA gives us a little break next year, maybe for 2 or 3 years in the changes that they're making to those E&M guidelines. So our coders and our physicians can really get acclimated to that major overhaul. Again, it always keeps us guessing, and I guess we'll have to look for those updates that will be just around the corner because we know that those begin again January 1st of 2024. So just really, again, we feel like that things will calm down in regards to E&M. So we'll see where, AMA does rehaul or make major changes for next year. Maybe it's with the other sections in our CPT code book. So it'll be exciting to see. It's one thing I always say: job security for coders. We're always always learning and growing. Never again, it's an exciting field to be in.
I kind of echo what Leigh said. I'm positive that there'll not be any further changes with ENM because it's more or less streamlined, made simple. So I think the only way forward is adapting CAC and improving productivity. I think that's the way forward as far as ENM is concerned, in my opinion.
Yeah. And the one thing we can all pretty much guarantee is that there will be changes, right? Because change is inevitable. We started off the show with that. So I want to thank both of you, Leigh Poland, Vice President Coding Service Line, AGS Health, and Lingaraja Prabhu, Executive Director for Coding for AGS Health. Thank you so much for being with me today. One final thing before we go: where can people go for more information if they have questions about our conversation, they want to learn more?
Absolutely. They can go to agshealth.com. They'll find resources on the services as well as technology we offer. But there's also free webinars and blog posts surrounding the E&M code updates. And we're always, typically it's usually once a month, offering free webinars on different emerging topics in the industry. And typically those are, we offer a CEU free to all live attendees. So I would recommend making sure that you sign up for updates as well. And then also follow our LinkedIn page. That's where we put a lot of postings regarding where we'll be at different conferences, as well as webinars, as well as when a new blog or newsletter post has been released, as well as case studies. So those are the two places that I would highly recommend following.
Perfect. Leigh and Linga, thank you so much for your time. Great conversation. A lot has changed. And as you both kind of alluded to, more changes will be on the way. So thank you for kind of breaking this down and answering some great questions here and giving people out there some wonderful information. So thank you. I appreciate your time today.
Anytime. So thank you as well.
Thank you, Michelle. Thank you.
And I want to thank all of you for tuning in to the RCM Chat podcast brought to you by AGS Health. And be sure to subscribe for more episodes, great conversations. But until next time, I'm your host, Michelle Dawn Mooney, and we want to thank you for joining us again. And until then, keep revving up those revenue cycles. We'll see you soon.